Okay guys, it's Dr. Sexton coming to you out of San Diego, and today we're going to talk to you about something that I see pretty darn often, and that is fatigue. Patients come to me often and they will talk about how tired they are feeling, and they really believe that this is something that is clearly some kind of illness because they couldn't be feeling this way otherwise. They either haven't felt this way before or this is to a whole new level. And so they want you as a doctor to figure out what it is going on with them that might be causing this type of a thing. Now, sometimes this can be because of real serious medical problems, and we're going to talk to you a little bit about how those things happen. But way more often than not, this is actually because of other things that are going on in their lives that are causing them to feel a lot of additional strain, and maybe they're not sleeping well enough. Maybe they're not getting some other aspects of their health taken care of that they normally would. So I'm going to show you how all of these things can play into it through a series of videos that we're going to do here. So take a look at this starting video so that you understand what fatigue can look like and where we can go from there. So whenever fatigue comes into the office presenting as a patient, what we first look at is, okay, what kinds of physical problems might be causing this kind of thing? From a physical standpoint, you might think of what kinds of things might be sapping this person of their energy. Are they not getting sleep, which is something that we obviously need in order to get our energy back? Are they having their energy being driven away from them by, let's say, an infection that is using all of their energy for inflammation, or allergies? And while the allergies are not their own infection, they are tricking your body into thinking that they are, and thus using up all of those nutritional resources and sleep resources so that you can use it for this allergic reaction that you've got going on. Any of these kinds of things sapping the energy from your body is going to be something that might lead to fatigue, even if we're talking about healing from some past injury that you've had going on. So take a look at those kinds of things. They can really be contributing to it. In addition to not having enough energy because it's being sapped from your body, you can also not be getting enough nutrition into your body. So you have to take a look at, am I getting enough nutrition, getting enough energy into my body so that I can supply my body's habits? For those individuals who have a little bit more muscle to their body, those muscles tend to store calories and store the energy for them. So if you're a little bit more of a less athletic person, understand that your reserves of energy are going to be a lot less than someone who has been exercising a lot more whenever you look at these things. Chemical issues that can cause us to feel fatigued. We can look at hormonal issues, whether we're talking about menopause or men going from a high testosterone to a low testosterone point, or a low thyroid can cause someone to be having low energy levels as they've got these things going on. These are going to be the kinds of things that you and your doctor work out whenever you first go to see him about the fatigue. But once those things are ruled out, very often you can feel confident that this is not what is going on to cause your problem, and you can then move on to the third category of things. And this third category of things are the mental things that go on. You know, as we've got more and more issues playing into our lives, more stresses, more pain, more issues that we are constantly thinking about, our brain has a difficult time looking ahead to the future and being optimistic and excited about those kinds of things. Now, if you'd taken us whenever we were 18 years old, we could have all of this enthusiasm to go through the stresses that we've got in our lives and still have some energy left over. That starts to wane after the years go by, and it makes it a little bit more difficult to have that kind of energy. These things play out into depression, and I know that it is hard to accept that maybe depression is one of the reasons that you are feeling this lack of energy. You've never been depressed before, but take this as a sign that maybe we should start looking at some of those problems that are causing you to feel less than motivated and see if we can overcome them, and talk to your doctor about whether seeing if a medicine for depression or anxiety might be the right step for you to try and take care of these. There are many other ones, but talk to them about those kinds of things. It can really help.